Thanks, Heather. I have been lucky enough to score the straight after lunch session, which I don't know what I've done to deserve this, but I'll do my best. If anyone feels like they had too many carbs at lunch and they need to stand up so they don't fall asleep, I won't be offended at all, I promise. Just stand up and move to the side so you don't block people's views. And I will try to keep it lively. All right, as many of you would know, WorkSafe provides a range of tools and guidance to support employers to meet their obligations under legislation. And this afternoon, what I wanted to do is share with you about one additional resource that we're developing at the moment. And it is focused on incident investigation, and specifically when there's an OVA incident in a health service. Why are we focusing on incident investigation? The Auditor General called it out, the department's called it out, our inspectors see it every day when they're out in your workplaces, the ANMF's called it out. It's not a strong point in our sector. We're great at doing investigations about clinical incidents when things don't go as we plan on the clinical side, but when it comes to health and safety, we don't do as well, and particularly when it's occupational violence and aggression, there's really a lot of room for improvement. But it's okay. By doing better investigations, we can help to prevent future incidents. When incidents happen, there's something that we can learn, and we don't want to let that opportunity go by. Particularly our inspectors, they feel so frustrated sometimes. They see a really nasty incident that's happened, and actually there was a previous incident and an incident before that and one before that, but not enough has been done to learn from that to make sure that something hasn't been, to make sure that it won't recur. So what are we doing? It's a pilot project. We've got 3 steps here. One is develop a tool to help unit managers to do a better OVA incident investigation. Then we're piloting it in some hospital wards to see what the impact is. And then we want to develop that into WorkSafe guidance. WorkSafe puts out guidance all the time, but we said, all right, this time we want to test it. Rather than just show it to people and say, well, you know, what do you think? Do you think it'll work? We want to get people to use it and then tell us what they think so that we can refine it and make it as user-friendly and as effective as possible before we produce it as guidance and say, hey, guys, everyone should look at doing it this way. It's a tool to assist unit managers who we know are busy people to better identify some of those contributing factors to an OVA incident, to better identify actions that can reduce the likelihood of a recurrence, and then some prompts around communication as well. Because we know that so often our staff report incidents and then they don't hear anything. And maybe it was investigated and maybe it wasn't, and maybe something was put in place to change that. But if you don't know, then that doesn't really get you very excited about reporting again next time. So, why a tool? Go here. There we go, that's what we're doing. All right, we'll skip through. Is that? Oh, sorry, the image hasn't come up. I had a beautiful picture of the tool there. We've tried really, really hard to make it quick and simple to use, because so much of the feedback that we get is, we don't have time. There is so much paperwork. There is so much to do. We're really understaffed. We don't have time to do a good investigation. We don't need more paper. So we've tried really, really hard. There's a lot of check boxes. So rather than asking people to write out a lot of stuff, consider which ones of these apply to you. And a lot of prompt questions with just a yes or a no to get someone thinking about whether something has or hasn't been done, was or wasn't a factor. They can yes, no, and then move on. It's 1 page, double-sided. This is not ever going to be a gold star incident investigation when it's 1 page, double-sided. But we know that at the moment, we have so far to improve, and if we can move everyone up to doing things a star that's not gold, that's fantastic. We'll put the trimmings on later, right? But we want everyone to say, yep, I can do a better incident investigation, and it's going to lead to better outcomes on my ward for safety for everybody. So, oh, there it is, sorry. In the first step, when we developed the tool, I didn't just make it up. I'm not that smart. We spoke with a lot of people. We spoke with nurses, with unit managers, with assistant unit managers. We spoke with OHS managers. We spoke to people in metro areas, in regional areas. And we spoke to people outside of healthcare, because incident investigation happens across all industries, and some industries are really great at doing this stuff. So we said, all right, let's look at what happens in other sectors. We consulted with the ANMF, we consulted with our WorkSafe inspectors who see this all the time, and experts in OVA and in incident investigation. We've had 1 million drafts, and I know quite a few people in this room have seen quite a few drafts of this tool, and we just kept coming back going, is it better yet? Is this going to be okay? Do you think this will work? And we've come up with a version that we think is pretty good. What it tries to do is prompt a unit manager to go through this process. Obviously, first, your first priority is looking at well-being and making sure that everyone is safe right now. But then trying to understand the details of the event and what were the contributing factors. We don't want to say that the reason that there was an OVA incident was because someone was upset. In terms of prevention, that's really not helpful. It doesn't get us very far to prevent that from happening again. So we want to come back a few steps and say, well, why were they upset? And what were the other things that could have contributed? What are the environmental factors that might have contributed in this incident? What are the staffing factors that might have contributed? What are the patient care factors that might have, and go through all of these sorts of factors so that we can get a better understanding of what we're dealing with. Because then, this unit manager is in a much better position to say, all right, well, what are the existing measures that we have that should have prevented this from happening? We already have training. Why didn't that? We already have a duress alarm. Why didn't that? That's, for all the OHS people in the room, that's your review and revision of risk control measures. And then, importantly, what can we do better to make sure we don't have a similar incident again? What's missing from this picture? Do we need to improve some of those controls we already have, or do we need to add extra ones? Like Will said this morning, looking at what's there already that maybe could be improved, and then what additional things might we need? But these last two steps here, I think these are super important, and we only get to that, well, what do we need to do stage, and then it kind of drops off the radar. It stops being the top priority. People who have responsibility for implementing these measures need to be aware of that. It needs to be assigned to someone, and it needs to go on their to-do list, and it needs to be followed up. Did it actually get done? And then we need to communicate the findings of this incident investigation with all of the relevant people. And that might be, in some cases, that might be a lot of people. There might be really good systems and processes to be able to do that already, or we might need to look at how that works in our organisations. But really, this process, it shouldn't sound like something that new for clinicians, because it's not that different to the process that you would go through for a clinical incident. It's not a really crazy out there kind of thing. It's not new. It's a really standard kind of process. But we're hoping that with this tool, we can prompt people through it. And being OVA specific, when we have some of those OVA specific contributing factors with the checkboxes next to them, it can really help people. What do we hope to see? What do we really hope that the benefits are from using this kind of tool? We hope that we get more effective incident investigations so that we're able to say, all right, this happened. We've been able to put something in place to prevent that from happening again. We also hope that there's increased awareness of OVA on a unit or a ward that's where the unit managers are using this kind of tool. And that increased belief amongst staff that OVA is not acceptable and that there are things that can be done to better prevent and manage it. And this links back to the campaign. It's about attitudes and that attitude that, yeah, I will report it because something can happen. If I report it, it'll be investigated and then something will change and then we'll have a safer ward. This is what we hope, right? This is the goal. Okay. And it's important to note that this is a prompt tool. It's to guide people through that investigation process. It's not a system. It doesn't change the way that you report. It's to help someone to go through that process. There it is again. So step 2, pilot the tool. So we've trialled it, we've just finished trialling it for 4 months in 9 acute wards at Frankston, Knox Private and the Royal Women's. And I know there's people from all 3 hospitals who've been involved in that here today, so a big thank you to you, because we can't pilot it if no one puts their hand up. Our research partners have been collecting feedback from participating unit managers and OHS teams, as well as the nurses on those wards. And they're currently evaluating the feedback and preparing recommendations for us and saying, okay, you developed this prompt tool. This is how it went when you put it into health services. So how should you now adjust it to make it the best version it can be to release statewide as guidance? What happened during the pilot? So nurses in the pilot wards completed surveys before we started using the tool and then after. What we really wanted to try and find out was whether their attitudes towards OVA changed, whether having their unit managers use this tool to go through this process changed the way that they saw OVA and changed their intention to report. Unfortunately, we had low response rates to the surveys, and I suspect there's a lot of people in the room who can believe that. There was a fair bit of survey fatigue going on. It's disappointing because it makes it hard for us to draw really firm conclusions about safety culture in those wards and attitudes in those wards that can change, hopefully, when the tool is being used. But we haven't received the final report yet, but the early indications that attitudes towards OVA that came out of those surveys were fairly consistent with other research that's been done in this space. So there was nothing sort of outrageous going on there. It's fairly consistent. After the pre-surveys were done, unit managers attended a briefing session about the tool. We said, this is the project, this is what the tool looks like, this is how we'd like you to use it, any questions? And they were encouraged to use the tool. So over the 4-month period, we said, whenever there's an OVA incident on your ward, when you do your investigation, use this tool to help you. And then at the end of the pilot period, they participated in an interview to talk about their experience using the tool. What was it like? Did you find it useful? How would you improve it if you had the chance? Because these are the people that we want to use it at the end of the day, right? We want to make sure it works for them. So I've put in some quotes here from some of the unit managers and OHS people. There's a great one there about culture changing on the ward, staff being more, reporting more OVA incidents and being more aware of the incident investigation process. And I think that's a really exciting outcome. If you can introduce this kind of tool and it can lead to that kind of change on a ward, then I think that's really powerful. Comments about using the tool helps you to focus on not the behaviour that happened, but what were the reasons behind it, what led to it. Good prompts and giving different levels, whatever level of management you are, something to think about, well, what do we need to do? What can we do? So for me, those sorts of quotes are really exciting. Some of the barriers that came out of those interviews, and again, I don't think this will be news to many people in the room, but things like, it's a time thing. It's a time factor. We just don't have time to do it. It's just the staff don't report the incidents. And yeah, if you're not aware of an incident, it's very difficult to investigate it. I get that. And this is, again, one of the links back to the campaign. One of the strong message for staff for that campaign is you need to report these incidents so something can be done. But we know that from the research, that people won't report if they don't believe that anything will change, that anything it's worth their while, which I think is fair enough. So that's something we're really trying to change here, and it's a bit of a vicious cycle, but if we can get people to see results and change when they do report, then that should help to build that momentum. And some comments about needing training on how to do a really good investigation. And so that's, I think, a great suggestion for us around implementation and saying, all right, if we have a template for a really great tool, how do we implement it in our health service? How do we make sure that people understand how to use it and can use it in their daily work? Some suggestions for how to improve it. It's a space issue. You know, you need more room to be able to write more stuff. On the other hand, the more streamlined you can make it, the better. So you can't please everybody. But yeah, we recognise it does need to be really simple and quick and easy to use. And wanting to see the tool incorporated into the broader reporting system rather than sitting outside of it. And that's definitely a theme that's come through right from when we first flagged this project at the beginning, and something that we're talking with the department about. So what now? Oh, sorry, I should have put those on the screen. We're working with our research partners to measure the tool's impact, make some improvements, and then release the tool as WorkSafe guidance. So we don't have that final report from our research partners yet. Once we do, it'll be easier for us to see the scope of work that needs to follow before we can publish that tool, and perhaps some case studies around it or some suggestions on implementation or something like that. But it would probably be early next year. Longer term, what do we want to see? Increased reporting of OVA incidents is, you know, I think what everyone wants to see, and hopefully this tool can really support that, because again, if you see a change from when you report something, you're more inclined to report again. Decreasing severity of OVA incidents and decreasing number of OVA incidents. It's a long-term outlook, but really taking that sort of prevention lens to incident investigation, and rather than seeing this as something extra to do, seeing it as an opportunity to prevent something from happening again. So I guess with incident investigation, what we hope is the tool can lead to a better investigation, which leads to better prevention and management and a safer ward environment. And I think something that was touched on this morning, this is a less stressful environment for staff and for patients and visitors. I think this is all stuff that we covered this morning. And finally, I just wanted to note that, you know, this is a project entirely focused on incident investigation. It's not the only thing that WorkSafe is doing in this space. We have inspectors out visiting health services, looking at what's happened after an incident. What's happened after an OVA incident? What was your review of risk control like? What was your incident investigation like? What have you done to prevent a similar incident from happening again? And also our guidance. Patrice mentioned this morning that that's been refreshed. The section on incident investigation has been updated and broadened. And then hopefully, once this tool is developed, it can be either incorporated into that or referred to in that. And as I've said, obviously all of this also links to the campaign and that reporting aspect. We've said to staff, you need to report, but one of the key messages for employers in the campaign materials is you need to encourage staff to report, and you need to do really solid incident investigations, because those two things go hand in hand. You need both. All right, I think questions are at the end. So